Today on Dueling Doctors, we're talking about 3 life and death issues that all of us should take seriously: cancer, diabetes, and stroke. What causes these problems, and more importantly, how can we prevent and treat them effectively? Doctors from the world of holistic, natural, and conventional Western medicine square off about the best course of action, and it starts right now. It's holistic and natural versus conventional health experts with different opinions and one goal: to help you live a healthier life. Dueling Doctors. Hi everyone, I'm Dr. Frank Spinelli. This week on Dueling Doctors, experts from the world of conventional and holistic medicine join us to debate and discuss the best ways to treat life-threatening diseases that can change our lives forever. Let's get started by introducing our guests. Joining me with a Western perspective is internist and rheumatologist Dr. Bassik Qayyum, and on the holistic side of the table is naturopath Dr. Serena Ma. Welcome, both of you.
Thank you.
Great to be here.
Our first topic is cancer, a general name for a group of more than 100 diseases. Cancer is characterized by the development of abnormal cells that divide uncontrollably and have the ability to infiltrate and destroy normal body tissue. Cancer also has the ability to spread throughout the body. Cancer is the second leading cause of death in the United States, but the survival rates are improving thanks to early screening and treatment. So now you know what cancer is, what are the options to try to prevent it and to treat it? Each of our experts has up to 1 minute to present a plan, and then the other will have the opportunity to respond. We flipped a coin before the show to see who would go first, and Dr. Ma, you're up first. So cancer, how do you even begin a conversation with a patient, especially after you've diagnosed it or if they've come to you with the diagnosis of cancer?
Dr. Frank, they usually do come to me already diagnosed, and they're quite panicked with family members at the office. Like,
Sure.
What do I do? Should I do chemo? Should I do radiation? Usually I do like to work with their oncologist. And personally, cancer, although it's such a terrible topic, working with these patients for me is they become one of my favorites.
So, and you mentioned that you like to work in conjunction with an oncologist or their private, PMD, their medical doctor.
Right.
Do you find that some patients come to you and say, listen, I'm going the natural route? I mean, of course, we've heard a lot of celebrities that have done it. Some people have done it successfully, where they said, I'm not going to do chemo, I'm not going to do radiation, I'm going to do an all-natural way. I mean, where do you stand in that?
Where do I stand? I prefer, depending on the staging, I'll listen.
Obviously, depending on the cancer and the staging.
If it's stage 1 and if it's an easy treatable cancer, then I might support them with that.
So you support them how? Like by diet first?
Diet. I definitely want to work on diet and lifestyle.
So talk to me about that specifically. What would
you want to
change?
make sure there's a lot of antioxidants. Like with cancer,
antioxidants,
your immune system has stopped recognizing tumor cells.
So immediately vitamin C or
vitamin C, vitamin E, CoQ10, green tea. There's a lot of research showing green tea, 5 cups a day of green tea.
If I had to put a staple of things you should take every day, green tea would be one of them.
Oh, definitely.
And it's also a great detoxer as well.
Green tea's great for so many things, yes.
Okay.
Green tea, I like to do 5 colors a day with food.
So 5 colored foods a day, natural colors, not artificial colors.
Not Cheetos.
Okay. But I do love a good Cheeto. Not anymore.
No Cheetos, please.
No. So 5 colored foods.
5 colors, right? Because from each of those colors, you're getting different flavonoids, different antioxidants that are helpful.
And what about the patient that comes to see you and said, I had radiation, I had chemotherapy, I have burns, I have nausea? Is there anything that you could offer them?
I support them throughout their cancer treatment. So if it's under radiation, they usually have the burns because
like
it's like a bad sunburn. So calendula cream or calendula lotion.
So calendula and aloe would also work well,
be helpful
topically.
As well. Staying hydrated.
Yeah, it's very important. And staying, and actually watching your calories, because people tend to lose weight as well. And how do you help with the nausea, because they might not want to eat because they're not feeling well?
It's the same as pregnancy. Ginger capsules, ginger tea.
Ginger tea, right.
Ginger lozenges. Really There's a good acupuncture point above your wrist. You've probably seen those C-bands.
Oh yeah, correct. Yeah, and that helps with nausea, right?
That could help as well.
Now I want to touch on prevention as well. What are some of the things we should stay away from as far as foods that might be cancer causing, that you might say to a patient, you know what, avoid these?
Right. There's so many chemicals in our environment now, and a lot of them have been linked to certain cancers. The most well known, I think, is BPA, bisphenol A, which is found in a lot of plastics. And a lot of states have now gotten rid of BPA in childhood products, but that has been that is a hormone disruptor, so it's been linked to prostate cancer and breast cancer as well as other conditions.
And what about your view on dairy as well?
Always hormone-free, antibiotic-free.
Antibiotic-free.
So your organic dairy,
Do you really feel like adults
meats.
need that much dairy overall?
I personally don't.
You
drink
personally
dairy at all,
don't. So okay. All right, just want to know personally between you and me.
personally.
Nobody's listening. All right, Dr. Quayum, nobody likes to talk about cancer, but obviously when they come to see you, annual physical, what are some of the things you might screen for a patient for cancer?
It's quite a difficult topic that is often discussed with the patient, and I usually follow the guidelines of the American Cancer Society's prevention and also for treatment guidelines. But one of the big things about screening, for example, colorectal screening, such as a colonoscopy.
So yeah, the guidelines are colonoscopy, 50 years old, men and women, boom.
That's correct. And then doing what's called a PSA, which is a blood test to test for prostate cancer.
Prostate-specific antigen is also screening for men for prostate cancer, and that's done as well as 50.
That's correct. And going along the lines of also doing mammograms and
Pap
smears and things along.
What I find interesting, though, is even though they have these guidelines and they have these ages, isn't it important to know someone's family history?
Absolutely. You know, obviously, cancer has a lot of genetic association. So knowing a family's history, especially when the patient just first comes to me, becomes quite important.
Yeah, because if we screen everyone at 50 for colorectal cancer, but my father had colon cancer at 40, I should be screened earlier.
Right. And then usually I like the patient, as I am proactive on the first visit, to ask them what their family history is concerning cancer. On the other hand, if a doctor forgets to ask that question, I always tell them to bring it up.
What about genetic testing? How important is it to get genetic testing without having a family history? Does it really tell you anything?
You know, it's quite debatable because some patients don't really want to know if they've not have a strong family history of cancer in the family. Going ahead and doing those tests, which can be costly, can become quite a bit of an issue.
But I think there are also statistics show that. I mean, 85% with a family history and BRCA have a likelihood of getting cancer, as opposed to someone with no family history, as I think it's down to at least 40%. So what do you do with that information is what I always ask patients when you get it. So it's important. One other question for both of you. I'll never forget, I went to the mall once and they were doing total body CAT scans on people, and they touted it as, you know, ways to know if you have cancer. What are you feeling about people just getting total body scans, CAT scans?
My answer is no.
No.
No, I don't think you know, it's worth doing it at this point, and there's
not worth the expense. It's not worth what you're going to find.
Exactly.
Okay, say it there.
It's not a proper diagnostic tool for cancer.
I know. I think people live in fear of cancer so much that they just want to know, and I think doing a total body scan will make them feel better about it.
They should just drink their green tea.
Make them more scared.
Drink their green tea and stay away from dairy.
vegetables.
And go to the doctor and get screened for cancer.
Definitely.
Oh, that's good. So I'm glad we're all in agreement about body scans, and I really like the point that you made, that you said that you'd like to work with the oncologist. I think that's very important. We have to take a break, but up next, find out the best ways to detect, treat, and prevent diabetes. Stay tuned. Welcome back to Dueling Doctors, the Life and Death edition. I'm joined by holistic Dr. Serena Ma and our Western counterpart, Dr. Quayum. Now it's time to talk about diabetes. Diabetes affects 18 million people in the United States. It is a disease that affects how your body uses glucose or blood sugar. Diabetics have too much glucose in their blood, which can lead to serious health problems. Today we will focus just on type 2, which involves insulin resistance. Insulin is produced by the pancreas to lower sugar levels in the bloodstream. With type 2 diabetics, the cells become resistant to your insulin. So now you know what diabetes is. How do you try to prevent and treat it? Each of our doctors has up to 1 minute to present a treatment plan, and then each will have the opportunity to respond to the other. Dr. Ma, you went first last time, so we're going to begin with you, Dr. Quayum. How does a typical diabetic present to you in your office?
Most of the time when the diabetics do present, they come in with symptoms of increased thirst, increased urination, feeling of weight gain, and most of the time they'll come in also stating that they feel very, very tired.
They feel fatigued, like they're just not right, sweating also?
Right.
All right, and so then how do you go about diagnosing it?
Most of the time the diagnosis is based on lab work and also on the clinical presentation that they do. I usually do a fasting blood glucose level to make the diagnosis.
So a fasting blood glucose level, not just a random, because a random sugar level really doesn't tell you much. I think the number is like fasting would be above 126.
That's
right?
correct.
And then do you also use hemoglobin A1C?
I use the hemoglobin A1C to usually follow their progress of how well the sugar is being well controlled.
So hemoglobin A1C, the red blood cells are glycosylated. They have a sugar on it, and that is how you can predict how well they're really reacting to treatment.
That's
you
correct.
measured that number because it's really what's telling you for like the last several months as opposed to just a random number.
Right.
So hemoglobin A1C. And then what about prevention? When you find a diabetic, what is the first thing you might say to them? You know, you have diabetes. Before we put you on oral medication, before we put you on insulin, what are some of the things you can do for a type 2 diabetic?
I think one of the first things that I really focus on is lifestyle changes. A lot of it is really monitoring their sugar intake along with daily monitoring of their sugars by using something called a finger stick, where they have this something called a glucometer, where they're able to check their finger sticks on a daily basis.
And how much does weight play into type 2 diabetes?
It's quite prevalent. It has been well known that reduction in weight will decrease diabetes and the sugar levels.
So just weight loss alone in somebody who's considered clinically obese or have a BMI of over 30, it will actually lower their sugars just by losing weight without any medication at all.
That's correct. There is some studies that do show that lowering weight will have a major contribution to diabetes and lowering their finger stick levels.
And then also, as you know, aside from the exam, what are some of the other things you tell patients to be on the lookout for?
I think one of the other things I tell them is very vigorous yearly examinations with their ophthalmologist, because eye problems are a major issue with diabetics, and then secondarily seeing their podiatrist, which is a foot doctor, to make sure they do not get fungal infections and some of the other diseases that are associated.
Yeah, because what diabetes really is doing, it narrows the arteries, and narrows the arteries in the eyes, so they get retinopathy,
Right.
and narrows the arteries in the kidneys, which is why they get so many kidney problems, and also in the extremities, especially the feet. So you really want to pay attention to cuts, make sure that they're healing properly, because that's another warning sign that you could be diabetic.
Right.
So obviously you want to have eye exams, because diabetic retinopathy is the #1 cause of blindness in America due to diabetes. And so that's, I think, the real points are podiatry, ophthalmology, and kidney function, as well as hemoglobin C. All right, so I'm sure you get a lot of patients that come in that have diabetes. What is your approach?
Likewise, lifestyle, diet. He said decreasing obesity. There's actually research showing that 3 days a week of 45 minutes of weight training and cardiovascular
Really?
reduces
Just incorporating some exercise,
3 days a week of
weight training,
45
and
minutes each
losing
of those,
weight. Right.
That can reduce hemoglobin A1C by 1%.
I mean, we were
in
talking
22
before
weeks.
the break, and you mentioned the Harvard study about...
Right. So there's a
tell
Harvard
us, 'cause
study
it's
that came out
fascinating.
last summer, I believe, that said a serving of white rice a day increases your chance of diabetes by 10%.
By 10%, 1 cup of white rice a
So
day.
reducing refined carbohydrates, anything white.
And I think that's so interesting, because there's so many cultures where rice plays an important part of their diet.
Right.
And I don't really think people really understand that a diet that's high in carbohydrates, like rice
So white
and
rice is high
pasta.
on the glycemic index. And what the glycemic index is it shows the sugar response, like how quickly sugar, it spikes your sugar levels
Right.
in your blood.
Which is what you want
so
to
white
avoid.
rice, right.
So what foods could you eat?
Anything that's brown rice is a much better option.
Brown rice instead of white rice.
So one of these
Quinoa.
whole grains. So white rice is refined. So the unrefined grains, anything that's high in fiber, Americans just don't get enough
So what would that
fiber.
mean to me? Because I think of a bran muffin when you say high in fiber.
But that also probably has sugar.
That's all. Yeah,
So we want to avoid some sugar too. You could add fiber supplements, vegetables.
So
That's
vegetables.
The best, the stuff that's really hard to chew, like celery
And broccoli.
kale and broccoli, the crunchy stuff that's full of fiber.
All right, I'm going to have some right now when we go to lunch. We have to take a break. When we come back, we're talking about a very serious condition, stroke. Don't go away. Welcome back to Dueling Doctors, the show where health experts from the world of conventional Western and natural holistic medicine debate the best ways to treat ailments that affect us all. Today we're dealing with those life and death conditions that you can't avoid. It's time to talk about stroke. A stroke or a brain attack occurs when a blood clot blocks an artery that normally carries blood and oxygen to that part of the brain. Interrupting blood flow can result in brain damage if untreated. Stroke is the fourth leading cause of death in America, and up to 80% of strokes are preventable. So now you know what it is. How can we prevent it? Dr. Ma? Okay, talk to me about preventing strokes.
Right, you said 80% are preventable.
Can you believe it?
Right, so some of the factors that increase the risk of a stroke are cigarette smoking, obesity.
Absolutely, get rid of cigarette smoking.
Yes, quit.
Why do we even talk
there's
about
nothing
this?
good about
it's unbelievable to me, but okay,
obesity, high blood pressure, high cholesterol, your diet, exercise.
So really, these are the things that you can do right now when you go to the doctor and you're talking about stroke prevention because, let's say, you have a high risk of family and you're a high family risk of stroke, is that you really need to watch your weight. You really need to have a healthy weight. You really need to follow your cholesterol and diet.
Right. You need to lower your blood pressure. You need to lower your cholesterol. I prefer it naturally through diet and lifestyle. And also blood sugar. You need to manage your blood sugar.
Definitely diabetes as well. Dr. Quayum, anything you could add? I mean, it seems like a no-brainer.
Right. And
but most people come in and, let's face it, we just said a fourth leading cause of death. I mean, why are so many people have these predispositions? They smoke, they're overweight, they have high blood pressure, high cholesterol. I mean, it just seems unrealistic to me to think that you could prevent it when people just don't take these preventative measures.
Well, I do think that, number one, you kind of have to keep an eye out for the signs of stroke. So catching a stroke very early on becomes important.
What does that look like if a patient presents with stroke?
I think it's a great question, and one of the things I'm always looking at, and I tell my patients, is things such as a droopy face.
So droopy eye, maybe slurred speech?
That's correct. And like one side of the body looks very weak, where you're unable to move a part of your body,
unsteady
or part of a
gait,
limb.
you know, you're walking, or even falls. And the other thing I think is interesting is that transitory blindness, losing your vision for a little bit, these are all warning signs. So talk to me about what is a mini stroke compared to a full-blown stroke.
Well, a mini stroke, you will have more of a different signs where you might have something called a mental status changes that may be for less than 30 seconds versus a stroke which would be longer lasting.
So really when you have a mini stroke or what they call a transient ischemic attack, you're having some of these similar symptoms, but they go away. And I think what a lot of people think is that, oh, I might have had a migraine, or I may be not feeling well, and they ignore it. And that's what comes from the 80% preventable as well, is that you should go to your doctor. That's really the bottom line.
Right,
is that you should go and see a doctor, because mini strokes could mean that you're going to have
a full-blown stroke afterward.
And then, so what are the things that you recommend for patients besides lowering blood pressure, what are some of the things you prescribe?
Well, I think, aside from the lifestyle changes that Dr. Ma was talking about, one of the things I always say is if you qualify, you should be on an aspirin, sometimes something called a platelet-lowering medications. There is a medication called Plavix that some patients are placed on to prevent future strokes if they fit a certain criteria that they're very high in being able to get one.
So the reason being is that somebody that might come to see you is really engaged, they want to do it naturally, yet somebody that might come to see you is still, I'm overweight, I'm smoking, I'm going to eat my, how many times were we at the clinic and you see a patient eating their Big Mac and taking a Lipitor. I mean, some patients are just not going to listen. So you would offer them aspirin?
That's correct.
An antiplatelet, you said Plavix.
Right.
What about lowering their blood pressure? What are the recommendations?
And again, if the blood pressure is a borderline level and they fit the criteria, usually anything above 140 is considered a high blood pressure.
So lowering blood pressure. And what is your take on using a statin, anti-lipid, lowering cholesterol?
Right. And it's quite debatable because some people, you get side effects that are associated with statins. So some doctors say, let's not put them on a statin immediately and let's do some of the other methods of using fish oil. But I agree with starting a statin.
I'm a big proponent of fish oil. I mean, it depends on how high their cholesterol levels are, but a big proponent of fish oil. There's even some natural statins to help lower.
So really low,
bit.
fish oil primarily to lower the cholesterol and triglycerides.
And fish oils can also affect blood pressure as well.
And they can really help post-stroke as well.
It's used a lot, post-stroke recovery. Also, ginkgo biloba is an herb that helps improve blood flow.
But you have to be careful with ginkgo if you're on a blood thinner as well.
If you're on any of those blood thinners.
So again, it's all about integrating.
Yes, it is.
You guys should exchange numbers. We need to wrap things up. I want to thank you both very much for coming in today. I learned a lot. We'll be right back. Welcome back to Dueling Doctors, the Life and Death Show. We touched on some pretty tough topics today: cancer, diabetes, and stroke. It's safe to say we live in fear of getting cancer, yet I find patients often live in denial. Prevention is the key. Discuss routine tests with your doctor to detect cancers that are recognized by the American Cancer Association. These tests include mammograms, PSAs, colonoscopies, and pap smears. Something everyone should do is draw a family tree outlining relatives who have had cancer. This information should be shared with your doctor. Genetic testing is only really helpful if you know your family history. Now, the key to diabetes is to maintain a healthy weight, exercise, and eat a diet that includes high-fiber foods, vegetables, and fruits. Keep regular appointments with your doctor to monitor your hemoglobin A1C, your cholesterol, as well as eye exams and foot care. And finally, for stroke prevention, avoid smoking, maintain a healthy weight and a normal blood pressure. Obesity, diabetes, hypertension, and elevated cholesterol increase your risk of stroke. Warning signs include numbness, sudden loss of vision, difficulty speaking, and an unsteady gait. Now, regardless if these symptoms resolve, you should check with a physician right away. I'm Dr. Frank Spinelli. Hope to see you soon on Dueling Doctors for more healthy discussion as you explore the best path to your own personal prescription. And as always, please make sure you talk to your healthcare provider before making any medical decisions. We'll see you next time.